In the spring of 2011, I was very sick. I could not eat due to chronic pancreatitis. I had a feeding tube which went into my small intestine, but that failed. I would become extremely sick and would vomit the feeding tube formula. In desperation, a permanent intravenous line called a PICC line, which stands for peripherally inserted central catheter, was inserted, and I was started on intravenous nutrition called TPN. Over the next 12 years, I had 10 PICC lines. Many people have asked me why I do not get a central line, such as a port-a-cath, a Hickman, or a broviac. Join me this week as I answer that question. To insert a PICC line, ultrasound is done of the upper arm to find a vein. Then a skilled clinician makes a small incision and threads the PICC line into the vein. The catheter is pushed farther into the vein until it is very close to the heart. It is an easy procedure which can be done almost anywhere, in a procedure room, patient's room, or even in the hallway. The only medicine usually given is lidocaine at the insertion site. To insert a central catheter, a skilled clinician has to thread the catheter from the exterior of the chest wall and through subcutaneous tissue. A second cut in the skin is needed to insert the catheter into the jugular vein. The catheter then has to be threaded through the vein until it is very close to the heart. Inserting a central catheter requires a lot of skill and should be done in a procedure room or surgery room. Sedation or anesthesia is usually needed to place the central line. I am very sensitive to adhesive in dressings. My skin breaks out in blisters. With having a PICC line, I can cover the PICC line insertion site with gauze and wrap my arm in a cloth bandage. I do not need to use an adhesive dressing to cover the line. With having a central line, the access point is in the chest. Using gauze and a cloth bandage to cover the insertion site will not work. An adhesive dressing is needed. This will most likely cause my chest to break out in blisters. Due to having a tracheostomy tube, I have a chronic cough and I frequently cough up mucus. Although I cover my tracheostomy tube when I cough, the mucus often flies out and lands on my chest. The mucus has in it various bacteria. With having a central line in my chest, I would be very concerned this bacteria-laden mucus would land on the central line, which could very easily cause an infection. Although I suppose it is possible for mucus to fly out of my tracheostomy tube and land near my PICC line in my arm. So far, I have never had that happen. When I go to the emergency department, hospital, or outpatient facility, as soon as my PICC line is noticed, it is used. The only place where a nurse refused to use my PICC line was at a doctor's office. She said she did not feel safe using it. I have friends who sometimes have nurses at hospitals or outpatient centers who refuse to use their central lines. They will be given a peripheral IV because the nurse will not use the central line. Both PICC lines and central lines can be used as long as they work and are infection-free. I have heard of central lines which are 10 years old. The oldest PICC line I have heard of is 2 years old. Since getting a PICC line removed and reinserted is a relatively easy process, I do not mind having my PICC line changed about every 1 to 2 years. While many people may think having a line which needs changing more often is a disadvantage, I believe it is an advantage. All inserted devices can develop infections on them called biofilm. These can be very slow-growing infections which can take months to develop into an active infection. The longer a device is implanted, the higher the likelihood the item will develop a biofilm infection. So, while it may seem like an advantage to have a central line in for many years, in fact, it can be a big disadvantage. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!